Trauma and stressor-related disorders occur when individuals experience a stressful or life-threatening event that leads to long-term psychological distress. Example is a soldier returning from war, but who still feels like they are in danger when they hear fireworks, or a child who experienced abuse and now struggles with forming relationships as an adult. These are common outcomes of trauma. Not everyone exposed to trauma develops post-traumatic stress disorder or other stress-related disorders. However, when symptoms interfere with daily work life or relationships, professional intervention may be necessary. Before we move forward, let's define some key terms that will help us understand trauma-related disorders. We have post-traumatic stress disorder or PTSD. This is a disorder where individuals experience flashbacks, nightmares, and severe anxiety after a traumatic event. We have acute stress disorder or ASD. This is similar to PTSD, but symptoms occur within the first month after trauma. We have dissociation. This is a mental process where a person feels disconnected from themselves or from reality. And we have reactive attachment disorder. This is a condition in children where they struggle with forming emotional bonds due to early neglect. What exactly is trauma? Trauma is any event or situation that overwhelms a person's ability to cope. It often leads to intense fear, helplessness, or horror, and can have lasting emotional effects. Here are some real-life examples of trauma. We have personal trauma. For example, is a survivor of domestic violence who has trouble feeling safe in relationships. Another one is collective trauma. Example is a community affected by a mass shooting or a terroristic attack. We also have the sudden loss. A person who loses their entire family in a car crash may experience extreme grief and PTSD. Each person processes trauma differently. While some recover naturally, others develop long-term stress disorders. There are three main types of trauma. One, we have acute trauma. This results from a single traumatic event. Example is a person who experiences a home invasion and afterward feels anxious about being alone. We also have chronic trauma. This involves repeated exposure to trauma over time. Example is a child growing up in an abusive household who may develop difficulty trusting others and suffer from depression. We also have complex trauma. This occurs when multiple traumatic events happen over time, often starting in childhood. Example is a person trafficked as a child who later develops severe PTSD, depression, and trust issues. The type of trauma experienced plays a big role in how individuals cope and recover. Not everyone who experiences trauma develops PTSD or another stress-related disorder. However, some factors increases a person's risk of long-term mental health effects. We have genetics. Some people have a genetic tendency to develop anxiety or depression after trauma. If a person has a family history of PTSD, they may be more vulnerable after experiencing trauma. Then there is early life trauma. This is experiencing trauma in childhood and can have a lasting impact on brain development. A child who is repeatedly neglected may develop attachment issues and struggle with relationships in adulthood. There is also the severity of trauma. The more severe and prolonged the trauma, the greater the risk. A survivor of prolonged torture or captivity may struggle with PTSD for years. Another one is the lack of social support. Having no support system increases the risk of mental health struggles. Example, a soldier returning from combat who has no family support may feel isolated and unable to cope. Identifying high-risk individuals early allows for timely intervention to prevent long-term mental health problems.